This is primary follicle, primordial follicle, then primary follicle. Then finally, before the ovulation, it is Graafian follicle. After the ovulation happens, the ovum is getting inside the fallopian tube. And afterwards, the shell which is remaining is called corpus luteum. If pregnancy is confirmed, the corpus luteum will remain there. If no fertilization happens, the menses started, then this corpus luteum will become corpus albicans. And finally, that will just disappear. That is the cycle of a follicle. Normal, in a healthy person, the cycle goes like this. If the cysts are formed due to poor water metabolism, there will not be any space for the first and second meiotic cell divisions here. So the improper development of the ovum or the follicle, will not be in a position to get into the ovulation mode. So already we have seen the hormones involved in this are FSH and LH. Estrogen and progesterone. These two are clubbed together, these two are clubbed together. That means FSH is the precursor for the follicle development. The FSH and LH are secreted from pituitary. Estrogen and progesterone are secreted from the ovary. So FSH first, there are two phases. If a normally 28 days cycle, menses cycle girl will be having the ovulation on 14th day. So the initial first 14, that is how it is to be calculated. From the 28th day or the onset of the menses, 14 days we will have to calculate. That is ovulation. In case if a lady who is ovulating at 32nd day regularly, from here 14 days. So on 18th, she will ovulate. So from here to here, this phase is called luteal phase. This luteal phase is post-ovulation. Before ovulation, it is follicular phase, where the follicle develops. So in this case, if you see the hormones, the FSH will be very high, and after the ovulation, this goes down. This is FSH. It reaches almost just before the ovulation to the peak. Afterwards, it declines. Whereas the LH will be low at the follicular phase and peak at the follicular stage, ovulation stage. This only triggers the ovulation and then goes on. So this is about FSH and LH. If you see, the estrogen and progesterone, this is 28 days, 14 days. Estrogen will be high in the first, then it will reduce, and the progesterone will be high. This is progesterone, this is estrogen, follicular phase. So without luteinizing hormone, ovulation will not happen. So LH is involved in ovulation. Even if the patient is having very good FSH, if the estrogen levels are less, then that is a clear indication that the patient is having PCOD. That is, FSH is normal. Estrogen is less. Whenever the blood test, these hormone tests are taken, now to ensure under which phase it is being taken. Because already we have seen the both are mainly more, the range will be more in case of follicular phase. LH and progesterone, they will be in the luteal phase. So there will not be any ovulation, that is anovulation, or because of the less estrogen, the maturation of the follicles takes long time, delayed, taking long time. That's the reason, because after that only the ovulation happens. Instead of 28 days, that may go to even 40 days, 45 days, erratic. That is the reason the persons with PCOD or PCOS will have irregular menstrual cycle. So once this is done, then in such cases, this will also trigger the release of LH. When the ovulation is not there, the corpus luteum, because corpus luteum only produces more of progesterone. When corpus luteum is also not there, because there is no ovulation happened, then where the progesterone will be more? Normally, overall tablet, overall, I think, that is the name of the commonly used tablet being given by the gynecologist, prescribed by the gynecologist to the PCOD, PCOS patients for regulating the menstrual cycle, which is a progesterone based one, giving more of progesterone. with this understanding, now we will get into this.
Sir, these patients having this vitamin D deficiency also will be there, no?
Yeah.
Okay.
So PCOS is a hormonal disorder which is common among the women of reproductive age. That is important. Which is characterized by the irregular or absent menstrual cycle, excess of androgen, less of estrogen, and multiple small follicles on the ovaries seen via ultrasound, polycystic ovaries. What causes this? Some cases genetics, very limited, and some insulin resistance. It is either way. PCOD will lead to insulin resistance, and insulin resistance may also trigger the PCOD. Because the high insulin levels in the blood that stimulates more androgen production and low grade inflammation. So if you see a person, the lady with more higher CRP, always ESR and CRP more, they may likely to have this. And some life cycle factors like obesity, sedentary lifestyle and all also causes. So what symptoms that we can get is that obvious
Sir,
irregular periods or no periods.
sir, there was a doubt. Here also insulin resistance is there, no?
Yeah.
Insulin resistance is there, but they are not diabetic. Why it is?
That means the production of insulin is very good by the pancreas.
Okay,
So the
okay.
period, irregular period is one, then weight gain definitely will because especially around the abdomen. That is the key one to identify the PCOD cases. They are like, the pear-shaped body. That
Many
is
of them
below the
have these
diaphragm,
problems. Many of them
up to
have.
the thighs. 90% nowadays because of various factors that contributes to PCOD.
Yeah,
Regular,
yeah.
regular, kids nowadays, younger kids are more vulnerable. So weight gain will be there, acne, oil skin will be there, excess hair growth, hirsutism on the face, chest, back, legs and all will be there. Thinning of scalp hair will be there. And of course, that will lead to the infertility also. Mood swings and depression because of the hormonal imbalances. So the complications that may caused by the PCOD is type 2 diabetes. It may lead to infertility, endometrial issues, endometriosis or endometrial cancers also because no prolonged anovulation. There is no ovulation happening that may create endometrial cancer. Sleep apnea will be there, depression, anxiety, cardiovascular disease because hormones are involved in this. So what TCM sees about it? It is a kind of pattern of imbalance on the disorder of the kidney, liver and spleen, and also the disharmony between chi and blood are the common patterns involved in this case. So the kidney yang deficiency, especially if you see the person will be having cold lips, fatigue, pale tongue, slow pulse, infertility are all related to the kidney yang deficiency. So 25 the kidney yang, warm the uterus because the first phase, follicular phase is in. After ovulation, that is yang. If yang is absent, ovulation will not be there. As simple as that. So enhance the kidney yang. Spleen chi deficiency with dampness, where the overweight will be there, floating, fatigue, excessive mucus, loose stools, all will be there. Case of liver chi stagnation and also the blood stasis. You see, liver supplies the blood to the uterus. So in case of amenorrhea, menorrhagia, or oligomenorrhea, liver is to be equally given importance. So in case of liver chi stagnation and blood stasis, the irregular menstruation will be there, mood swings, breast tenderness will be there, clots in menstruation. So in this case, we'll have to move the liver chi, invigorate the blood and regulate the menstruation. Phlegm, damp, obstruction will be seen often in women with obesity and the multiple cysts. So normally the points we use is, the points used are spleen 6. It's a key one, mainly with pressure. Then stomach 29, 30, CV 2, 3, 4 and CV 6 also. Then LI 4 and liver 3, 4 gate. These are all the common points, and then according to the pattern, we will add the other points also.
Sir, almost all these patterns comes together, no?
Not all together. If you see,
Okay.
it will be distinct.
Mm.
The points we will choose according to the involvement of the condition. If it is a kidney is young, then use the point accordingly. Reduce the 25 the K2.
Okay. They have frequent urination, no? Because of
Frequent
kidney yang
urination will be
deficiency.
there.
Yeah. Then fat, this also, fat also. So spleen T deficiency also there, no?
If it is there, the obesity will be there, appetite issues will be
Obesity.
there, all those things.
Okay.
So the
Then
points.
also
Hmm?
periods also not regular, no? So after.
That is automatic.
Okay. So all together, no? That's why I just asked.
No, altogether symptoms, but the cause will be unique.
Okay. So from where we have to start? All these three, obesity is there, frequent urination is there, cold sensation is there. Every time they are cold. Then
Kidney,
okay.
mainly kidney.
So we have
And
to start
spleen,
from kidney.
SP9, add SP9 also, because spleen is the aspect of kidney.
Yeah. Okay.
SP9,
Mm-hmm.
K3. When you are putting K3, then automatically it balances.
Okay, sir.
Under the scalp, MS4, under zoos, it is reproductive area, then kidney and urinary bladder. In case of auricular, it is endocrine, then ovary, liver, kidney, spleen, as the case may be, then sympathetic and Chennai. Under the herbal, for all PCOD conditions, the caesalpinia bond cell works exceedingly well along with pepper. In Tamil, it is called Kadarchikai. The one solution for all period-related issues, whether it is PCOD or uterus-related problem, hormonal imbalances, all these works, caesalpinia works exceedingly well. Under the seed, black cumin and the ovary correspondence, and also the red color there. Surya Mudra in order to enhance the heat, yang, then Vayu Mudra. Are the common points, mudras.